MMT, shoulder horizontal adduction, pectoralis major, both heads together. Assist the patient to the supine position with the shoulder abducted to 90 degrees and the elbow flexed to 90 degrees. Stand at the side of the shoulder being tested. Passively horizontally adduct the patient's shoulder. Support the arm by placing your hand under the elbow joint and at the distal forearm. You are not assessing the infield. You are determining how much range the patient is able to move the shoulder in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to horizontally adduct the shoulder. Stabilize the patient at the opposite shoulder. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include using the biceps by increasing the amount of elbow flexion, using the triceps by increasing the amount of elbow extension, and using the anterior deltoid, which causes internal rotation of the shoulder. You must make sure the motion is in the plane of horizontal abduction. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the opposite shoulder. Your other hand is placed at the distal forearm, just proximal to the wrist, unless the elbow begins to extend. If so, you would apply resistance at the distal elbow. The resistance is applied in a direction toward horizontal abduction. Grade 5, normal. The patient completes full range of motion in shoulder horizontal adduction and holds against maximal resistance. Grade 4, good. The patient completes full range of motion in shoulder horizontal adduction and holds against moderate to strong resistance. Grade 3, fair. The patient completes full range of motion in shoulder horizontal adduction but does not tolerate any resistance. If these conditions are not met, the patient must be repositioned to a gravity-eliminated position. Position the patient sitting in a chair. Allow the patient's arm to rest on a surface such as an adjustable table so that the shoulder is abducted to 90 degrees with the elbows slightly flexed. Stand at the side of the shoulder to be tested. Stabilize by placing one hand over the superior aspect of the clavicle. Grade 2, poor. The patient completes full range of motion of shoulder horizontal adduction with the arm supported. For grade 1, palpate the pectoralis major muscle on the anterior aspect of the chest at the anterior border of the axilla. Instruct the patient to try to horizontally adduct. Grade 1, trace. Palpable contractile activity of the pectoralis major with no motion. Grade 0, no palpable contraction.